So I'm just here today to talk about some of the opportunities and how nutrition careers are present in healthcare, what their roles are, and roughly what like the broad description is and what the goal for those professions are. My name is Erin Lind, and I thought I would start by introducing a little bit about me and how I came into be a dietitian. I was originally born in Olympia, where I still reside. I left long enough only to go to Washington State University and get my bachelor's in human nutrition. When you are getting a degree in human nutrition, if you want to further that and become a registered dietitian, you have to not only get a bachelor's in nutrition, but you also have to complete an internship. And an internship involves so much time in clinical nutrition, food service management nutrition, and community nutrition. And there'll be more references to those three categories later in my presentation. I was able to do my internship partly in Pullman, where Washington State University is, and also do my clinical part at the Madigan Army Medical Center. Right out of school, I got a job working in a WIC clinic. And for those that don't know the acronym, it's Women, Infants, and Children. And it is classified as a community nutrition program. I spent a year there, which was really, really quality learning about kids and parent-kid interactions. And then I really wanted to use more of my degree. I wanted to use more of the calculations that I had used to do tube feeding and all the different diets that we could teach people on. I wanted to use more. So then I applied to Grays Harbor Community Hospital. And for anybody that doesn't know where that's at, that's in Aberdeen, just about 45 minutes out of Olympia. And they gave me my first opportunity to work in a hospital setting. And I got a chance to work really closely with the dietitian that had been an RD for 20 plus years. And she was a wonderful mentor to me. So as I was falling down, doing half things right, half things wrong, she really would just pick me back up and say, you know what, you're doing good. Just got to keep learning. It was after my year at Grays Harbor that I wanted to get a little bit closer to Olympia. I was having my first child, and Olympia is where I've stayed. So I applied to the St. Peter's Hospital in Olympia. And I got a chance to work in the coronary artery bypass program, which is open heart surgery. And I stayed there for about 4 years working in cardiac care, which was just a huge learning curve. Because if anybody has known a grandparent that's gone through coronary artery bypass surgery, it's a huge undertaking. And after those 4 years at St. Peter's, I still didn't feel like I was using everything that I could. I wanted to get to a bigger hospital. I wanted to use more of my skills, do more tube feeding, do more IV nutrition. So that's when I applied to Multicare. And that's where I have stayed for 16 years. Initially came into Multicare as an adult hospital dietitian. We call that acute care. And I worked in their coronary artery bypass program. Soon after that, I got my opportunity to work into the ICU, the trauma med-surg ICU, and also the neurological ICU. And that's where I stayed for about the rest of the 11 years. Soon after that, my boss came to me and said, I really, really need somebody to work in pediatrics, and you've got the stuff. Could you please consider it? Scared, very scared. Kids are scary. Especially making sure that they grow and get everything that they need to grow is scary, but I committed. And I did my next year still in Multicare, but at the Mary Bridge Hospital. And for anybody that knows Multicare, we own about 6 hospitals: Tacoma General, Mary Bridge, Allenmore, Good Sam Hospital, Auburn. And I took a chance and moved into a position at Mary Bridge Acute Care Inpatient Hospital. Learned droves. I just learned tons of information about how itty bitty premature babies grow, how a child will still grow even when it's on a ventilator machine, just huge growth. Then she came to me, the same boss, and said, I really have a position in Olympia where you live, and you could work closer to home, but you have to work in outpatient clinics. So that's a different breed, right? And I need you to learn everything from gastrointestinal care to respiratory care to endocrinology. And for anybody that doesn't know those terms, gastrointestinal care includes everything, any disease state that can affect your intestines, your swallowing ability, and in kids, that's typically where we send the kids that aren't growing because they aren't digesting all their food or they're not absorbing all their food. The respiratory clinic involved a lot of cystic fibrosis. So for those that don't know what cystic fibrosis is, it's a condition kids are born with where they make too much mucus and they make too many plugs of mucus in their intestinal tract. So these plugs of mucus can prevent you from absorbing all your food. So you can imagine how tough it is to grow a child that isn't absorbing half of their food, right? And the third clinic was an endocrinology clinic, which just means diseases of hormone diseases. So that's your type 1 diabetics, that's your short stature kids, and a lot of like Turner syndrome, metabolic conditions where kids stay short, right? So I did that for 3 years. And last summer, this very same boss that's pushed me and encouraged me to try new things came to me and said, she's getting a position up higher as a director for our entire nutrition services program. And she would like me to consider being the manager over all the dietitians. So if I thought I was scared going to pediatrics, that's nothing compared to the fear I felt when being asked to take on a manager role. Since then, over the past 9-10 months, it's been great, but a little bit scary. So if you're okay, I'm going to move on to the next slide. Roles of nutrition in healthcare could be classified into 3 categories. I'm going to move this over here. If you heard me and listened when I was telling you about my internship, I'm going to get my registered dietitian license. You have to do, you have to put so much time into community nutrition, food service management, and also clinical nutrition. So I'm going to start with community nutrition. And we have a new person. Can I pause and ask Lindsay?
Hi, Erin. Yes, I'm Lindsay Woolsey, and I'm actually here to just play the role of moderator, which means I'll just ask some questions along the way. But hopefully everybody else will also ask their questions along the way. So don't let me interrupt.
Okay, well then I'll pose my question to Natcha. What do you think of when you hear community nutrition? What does that mean to you?
So I think it means that like the normal person, what normal person have to eat or drink.
Close.
Maybe.
Very close. Community nutrition by definition is the process of helping individuals and groups develop healthier eating habits in order to improve not just the betterment of one, but the betterment of the entire community. And so the real common thread to being in community nutrition is that you don't necessarily get in there and micromanage how many carbohydrates or how many grams of fat somebody is taking, because you're just focusing in on the one. You're looking at groups as a whole and seeing how we can improve the health of this entire school or this entire WIC clinic, right? You're looking from a broader lens at how to improve nutrition. So in community, the great reward is that you get to see an entire group of kids or adults improve and build relationships. If there was ever a downside to community nutrition, it's that you don't get in there and do the nitty gritty, do tube feedings or TPNs. You're looking at making sure a group of children are getting more protein or getting enough calcium for their bones, right? So the areas in which you are going to be able to get into community nutrition would be that women, infants, and children clinic that I mentioned. It was my very first job. It was I hope you heard that I said really good things about that first job, because I learned a ton. I learned that there is government money out there to help women, infants, and children that don't have enough money to basically feed their entire family. So a family who's struggling with money might be able to get on this program because they have one person working in the house, but they might have 5 kids, right? So that's almost impossible to feed 5 kids what you need in order to make all 5 healthy. So that's the intention behind why the government puts money into this program. So we need dietitians in a WIC program at a couple levels. We need dietitians up at the administrative level, determining when we give these free checks each month, how much money are we allowing for protein? How much are we allowing for vegetables? How much are we allowing for fruit and dairy? And you need a dietitian that knows what's necessary for growth to be able to make sure that you're giving enough for protein, enough for fruit, enough for dairy to take care of bones, right? So you can't necessarily worry about the nutrition of one individual. You're making decisions for a group of individuals, which makes it community nutrition. Are there any questions about the WIC program? Natcha, have you ever known anybody on WIC that gets little checks or a little debit card that they go to the grocery store with?
No.
It's a pretty cool system. They've changed it from taking checks to now they give you money for these certain foods, and they tell you how much you can spend on cereal, how much you can spend on milk, how much you can spend on meat, right? But then they give it in the form of a debit card. So nobody's in the register line pulling out checks and making it really obvious what you're doing. They just swipe their debit card, and which I think is just huge. I think was a huge move. The next program I can think of that would be community nutrition that would require a dietitian would be a supplemental nutrition assistance program, otherwise known as SNAP and otherwise known as food stamps. You might know this as a family that gets free money and free coupons each month to help out their entire family getting groceries, right? So think about WIC as the assistance we give in the very first 5 years of life. Think about the SNAP program is how we help families after that 5 years of life. It requires the same type of dietitian to come in and say, okay, for a family of 6, they're gonna need, in order to stay in good nutritional health, they're gonna need so much protein, they're gonna need so much dairy, they're gonna need so much fruit and vegetables and so forth. And that's how, that's the role of a dietitian in a food stamp program, is to make sure that we're taking care of the health of the entire family. Dietitians in the SNAP program, the food stamps program, don't unfortunately get to see a lot of patient one-on-one interaction. They're up a little higher in the tree trying to navigate, are we giving enough micronutrients, enough vitamin A, enough calcium to take care of this entire family? So any questions on that, Natcha? No? Okay. The final community program that I can think of that really, really needs a dietitian and nutritional guidance is home health and hospice programs. If you've ever had a grandparent that has desperately wanted to stay in their home instead of going to a nursing facility or instead of going to assisted living, sometimes as you age, you really can't do all of the things that you need to take care of yourself and keep yourself in good health, right? So you might need the assistance of a home health nurse to come in, take your blood pressure, watch you take your medications, right? You might also need the help of a dietitian that comes in and makes sure that you're actually eating 3 times a day, that there isn't rotten food in the fridge, that takes your weight, make sure that you're not continuing to drop weight and get weaker and weaker and lose muscle, right? And so a home health and hospice program would employ a dietitian to come out to the home and be able to see somebody in their home environment and see, oh my gosh, this person they cannot be eating 3 meals a day because when I open up the fridge, everything was rotten, right? And how do I take care of this, this family, this person living independently? Are they not getting enough? Do they not have enough money for food? Let me get you food stamps, right? are they not able to stand at the stove and cook a meal? You know, that's sometimes the role that a dietitian will take on is see, are you too weak to make your own food? Let me bring in Meals on Wheels or a home health caregiver that can sit and make 3 of your meals and leave them for you in the fridge. So that is another role that a dietitian would play in the community nutrition umbrella. The common thread is improving the health again of an entire group, not just one individual. Any questions so far? I've got some. Here's an example of how Multicare, where I work, has a community nutrition clinic. We have a WIC program where we employ several dietitians. And here's the little waiting room they would come to. They also weigh and measure those infants to make sure that they're growing, and they take head circumference to make sure that they're actually, you know, getting enough nutrition to support brain development, which is huge. So.
Erin, before you go on, do you mind if I ask a question? And I know that there are quite a few folks on. There are 15 participants. If others want to turn their video on, feel free.
Oh, I've been plugging poor Nutcha.
And I do see a question in the chat box.
Yes.
And that was from you, Nutcha. Again, I think, does the family have to sign up for nutritionists to come from their home, which I think is a great question. Others, I will encourage you, definitely throw questions into the chat box, because that will go directly just to our breakout now that we're in breakout. So for the other dozen or so students on the line, definitely ask questions, either turn your—
Apologies, I only saw a few faces.
Yeah, no, I know, not everybody has to, of course, you don't have to turn your video on, but if you have more questions. So if you want to address that one, and then Alan just asked a question as well about how many people are currently receiving care for these programs, and then how many people work in these programs. And maybe before you answer that, I'll just maybe make a comment that I'm really struck by, you know, I think when we think about dietitians and nutrition, we think, well, you have to know a whole bunch about food and what keeps you healthy, right? But I think what you're also demonstrating already is you also have had to really gain a knowledge about government programs and who qualifies and how to get those program benefits to your patients and the families in need. And so I'm just really struck by that this is a lot more, right, than just knowing about how to keep bodies healthy, but it's also about navigating programs on behalf of your patients. So I appreciate that knowledge that you're bringing. Do you want to address those two questions?
Yes.
Kat?
First question I heard was, how does somebody get on home health and hospice to bring all of this care into your home, right? It all starts with a family care physician, by going in and seeing your family care physician and saying, I'm not doing well. I'm not taking my meds. I forget to take my meds. I'm losing weight. I can't get to the store enough. And the referral to a home health company comes from your physician. And they first start by documenting in your medical record that you are failing to thrive or you have debility at home, and that helps prove the need. And there's a couple home health companies around here. Providence Home Healthcare provides in-home services. Multicare has their home health company, Quorum and Option Care. So they all employ pharmacists, nurses, dietitians to help take care of a patient while they're trying to stay independent living. I hope that answered the question. How many people are receiving this care would definitely be county specific. And I don't know how many Thurston County has. I can tell you from a different vantage point, just in pediatric care, and in Tacoma, Washington, we have over 600 kids receiving care in home. And we're not the only gig in town. And we have competition. So if Multicare Mary Bridge Home Infusion Company has over 600, and then we have competitors also with their little roster, I can't put an exact number to you, but I can assure you it's a great deal of people that need home care services. So it's a half an answer. So There's a box here. I'm gonna.
Yes.
Yeah, Lindsay, are we closing? Sorry, I'm the other
I
helper
hope
moderator.
I thought we had more time, but
I
it
thought so.
doesn't.
I thought
Yeah,
we had
maybe it's an
3:45.
accident. Yeah.
Well, I can get to my next because
I think you got interrupted. Do you want to just pick up where you left off?
I was ready to move on to category number 2, which is food service management. And food service management, by definition, is the process of providing access to food, well-balanced nutrition, and preventing hunger in facilities outside of one's home. So areas that would require food service management would be nursing home and assisted living facilities. When those people where home health has failed and they are still unsafe to stay in their own homes might need to be moved into an assisted living facility where they go into a big dining room and eat all 3 meals. Well, they need a dietitian at the helm, making sure that for an aging population, we are getting enough protein to support regeneration of their muscle tissue, that we're getting enough calcium and vitamin D for those bones that are getting more brittle with every decade. So in a nursing home facility, you'll need somebody at the top making sure that the meals provided are providing enough micronutrients and macronutrients. And for those that don't know those terms, macronutrients means enough calories and protein to get by. Micronutrients means enough zinc, calcium, vitamin D, vitamin A, vitamin C, all your little vitamins and minerals need to be represented in those meals. Another place where this is, we need a dietitian at the helm is the USDA Food and Nutrition Service Program. And that is a really broad way of saying the state agency or the government agency, I'm sorry, that dictates what our local school district will provide for breakfast lunches to our students. It will dictate what that preschool that it has the 3 to 5-year-olds in it, what they provide for breakfast, lunch, and snacks. And it will even dictate all the way to the college level, what is provided in the dining halls as an adequate breakfast, lunch, and dinner for those growing bigger kids. I can say that because I have one in college and she still needs help knowing what to eat. Daycare, in-home daycare facilities I covered. And anybody that's had a brother or sister or a child go through YMCA, after school care, programs like that are also require a dietitian to say what is an appropriate after school snack that nourishes a child and helps brain development while they're waiting for their parent to come pick them up. Also going to throw in there Department of Corrections. We did say a facility outside of one's home. So just because you might have made a mistake and you're incarcerated doesn't mean that you are any less important or any less entitled to adequate nutrition care. So they need dietitians in correctional facilities making sure that they have enough protein, calories, and their bones are taken care of, and they get some dark leafy greens. So in that population, and I've actually experienced that working in hospitals, a lot of them end up with injuries and large wounds that they need to heal. So when they return to the correctional facility, they might need a higher protein diet until they heal up this big gaping wound of theirs. So there's a need for a dietitian, even if you're not necessarily doing that one-on-one counseling like you can in a home environment. You still have a role in making sure that you're providing well-balanced, adequate meals. And the common thread amongst this little arena is to ensure adequate volume of macronutrients, calories and protein, as well as micronutrients, vitamins and minerals, are provided in meals while you're away from home. I'm going to show you
5-minute warning. Sorry,
okay,
go ahead.
Appreciate it. That's okay. Food service in hospitals looks like providing all these delicious snacks and opportunities for visitors that come in to visit their loved ones that have been admitted. We talked about food service in schools and daycares, like a dietitian would help create a menu just like this for if you had an in-home daycare. After school Y care, quite possibly one of the funnest jobs, I think. Final category of nutrition roles in healthcare would be what we call clinical service nutrition. And this is the process of providing adequate nutrition during acute illness, speeding the healing process and returning patients to home in a better condition than we found them. Dietitians are going to be in your hospitals, all the way from your, Tacoma General's, St. Peter's, to even your new psychiatric hospitals like the Wellfound that just opened up in Tacoma. We're going to need them in outpatient clinics because the hospital is not just the only place people get medical care. They also need follow-up in outpatient clinics, anywhere from a cancer clinic to a GI clinic to respiratory to endocrinology, as well as extended care facilities. Sometimes people aren't ready to go home. They need about 3 weeks of physical therapy to get better. Well, they also need meals during that physical therapy time in order to build muscle and to keep improving. So the common thread is to ensure the adequate consumption of nutrition to facilitate healing and improve strength with the goal of going home. I had to break this category up into 3. This is where I spent over 3/4 of my time was acute care in hospitals. You assess the patients that come in, whether they need a dietitian, do they need a dietitian or not? If those that do, that are high risk, they're underweight, they're losing weight, you complete an assessment on them. Sometimes they aren't able to even take enough food by mouth. They're just too fatigued, they can't swallow. So we have to place a small tube up their nose and down into their stomach. And the dietitian is the one that determines what formula, how much formula, how we give it, how is it being tolerated? Are we gaining too much weight? Do we need to pull back? And in the worst situations, sometimes your GI tract, your intestines don't work. They don't absorb nutrition. They don't push nutrition through. So you have to be fed through your vein. And it's probably the scariest type of nutrition, but you definitely need dietitians in there determining what's the right amount of calories, how much protein, how do we give IV nutrition and not risk ruining a vein or causing an infection.
2-minute warning. Sorry.
Okay. The part that gets the most exciting is educating people when they've just been diagnosed with diabetes, or they have pancreatitis, or they just learned that they have celiac disease and they can't eat this thing called gluten. Gluten's in everything. What do I eat now? That's where we get to be first on the scene and go into these rooms and reassure them that life will go on. You will be able to eat a carb again. So here's a group of my dietitians that do that bedside teaching and figure out how much tube feeding to give somebody and how to feed you through your vein. The final one would be outpatient. So after you get better, you get well enough to leave, you also need nutrition care from dietitians that help keep the process going. And here's where we also get to do education on food allergies, Crohn's disease, again with your diabetes, cystic fibrosis, where you have all those mucus plugs in your intestinal tract. These dietitians in an outpatient setting are also ordering tube feeding. They're also managing, I meant for there to be a picture there. They're also helping with IV nutrition. They just get to do it on a longer term. They get to build the relationships with the families and have the return customers that just fall in love with them as a human and want to only see that one dietitian. And then here's the final role, the one I've crested into, where you get to create menus for those hospitals and for those clinics. I get to hire, train, and coach incoming dietitians. I get to bring new dietitian interns into our facility so that we can train them and maybe have a pool of applicants when we have an opening. It's the best way to try somebody on is to get an internship. They fall in love with you and then they want to hire you. And I also get to do some quality improvement where I monitor the work of all of our dietitians. I go and sit in the rooms while they do educations. I go and look at their chart notes to make sure that they were thorough and they met all of the needs.